appear to be sitting, but my body is running a marathon. I had good intentions this morning, then my POTS laughed. Do I look normal to you? Like nothing's wrong? Could you have what I have? Today I'm going to explain what POTS syndrome is, who does it affect, what are the symptoms, how can you get diagnosed, and types of treatment. So what is POTS syndrome? POTS is postural orthostatic tachycardia syndrome. It was where my heart rate abnormally large increase when I go from sitting down to standing up. Large studies have shown that a viral illness or surgical procedure can act as a trigger factor, as known by Gertrude Boris and Jeffrey in the 2015 article POTS Association with EDS. So I had my appendix out about a year ago, and it triggered my POTS, and it got significantly worse. So who does it affect? As stated in the article, postural orthostatic tachycardia syndrome, otherwise known as POTS, by the Cleveland Clinic, the majority of POTS patients were women, ages 13 to 50 years old, and about 450,000 people suffer from POTS in the United States. Most people don't even know about POTS. They don't understand what it is. It looks like nothing's wrong on the outside, but there's a lot wrong on the inside. So what are some symptoms? Tachycardia and palpitations. My heart races. My heart rate is usually like 120 when I go to the doctor's. Shortness of breath. It feels like I ran a marathon and I can't breathe. Cold extremities. My hands and feet get cold. Fainting. I pass out like 5 times a year. Muscle weakness. I have my dad open up my water bottle because I can't open it by myself. Blood pooling in hands and feet. My blood pools when I am standing up, so I am sorry, but I have to sit down for this. Fatigue. I sleep a lot later than most people, and I have to take naps during the day. Brain fog. The other day I put my cereal on a plate. Migraines. I first got diagnosed with migraines 2 years ago, and I just thought that's all was wrong. Heat and sound intolerance. When I'm doing homework, I have to have the light off. This bright 16-year-old was suddenly unable to participate in his classwork, complete his schoolwork, and enjoy social activities with his friends, as noted by Ness in the book Power Over POTS, A Family Guide to Managing Postural Orthostatic Tachycardia Syndrome, published in 2017. So how do you get diagnosed with POTS? I got diagnosed with POTS through a tilt table test. I laid down for a minute and they checked my blood pressure and heart rate. I stood up and it was supposed to be for 10 minutes and they check your blood pressure and heart rate, but I only made it 6 before passing out. You can also have a heart echo done, blood work, and an EKG on your heart can help diagnose. People are fairly new to POTS, and many doctors often misdiagnose. Most physicians have no knowledge of this condition, as noted by Ness in his book Power Over POTS, A Family Guide to Managing Postural Orthostatic Tachycardia Syndrome, published in 2017. So some treatment options. There is no treatment really, just salt water and exercise, and doctors can put you on medications for some of your symptoms. There hopefully will be a treatment one day. you can go to chronic pain clinics to help out with your pain. So today I talked about what is POTS, who does it affect, the symptoms, and how you get diagnosed and treatment options. Never judge a book by its POTS cover.